Hi, my name is Maya Afruzi and I'm licensed occupational therapist and I am specializing in treatment of pelvic floor dysfunctions. I'm also certified trauma-informed pelvic floor therapist and I am here to talk about not just pelvic floor, how it's important to be referred to pelvic floor therapists. It's important because not every specialist will refer a patient who needs therapy to the therapist, but there are conditions that we really can help. We can prevent complications in the future. The statistics shows us that 50% of women they suffer from some kind of incontinence or prolapse, but they do not go to the specialist until it's too late and the surgery is necessary. So that's why more and more people, I feel like, need to know how pelvic floor therapy can help them. So, what are the conditions that we're working with when it comes to pelvic floor? Definitely pelvic pain. Sometimes it's unexplained pelvic pain, and we don't know why it's happening. However, we start to learn more and more that pelvic floor directly related to nervous system, and the vagus nerve is the one that needs to be addressed if the pelvic floor dysfunction in the picture. So also urinary and fecal incontinence, constipation, vaginismus, vulvodynia, coccydynia, dyspareunia, pain with penetration, groin pain, so many of them, endless list. However, what is the pelvic floor? It's basically why everybody says pelvic floor, pelvic floor. What? It's a group of muscles that are basically in men it's below their reproductive area and same for women. It kind of creates you can say a trampoline because basically everything above is held by those muscles. That's why when prolapse happens, those muscles start to get weaken and weaken and weaken, and organs start to go lower and lower. So, as therapists, do not approach pelvic floor just from the perspective of body. Every time we have a patient, we definitely look at the person, what kind of background they have, when that started, and definitely on their cognition, nervous system issues, and definitely their trauma. Therefore, I'm here in this clinic and I would like to help as many patients as possible to prevent any kind of challenges, really big challenges in the future when it comes to their pelvic floor. What my treatments include? Definitely, we have a big, comprehensive, long evaluation. Patients fill out the form, we ask questions, we want to know as more as possible about the patient, what they're doing during the day, what are they eating, what are they drinking, how is their schedule, what their work is about. Many questions. This is such a broad subject that every person is definitely going to be treated individually based on their individual needs. We do not have one approach that we use for every patient. It's impossible. If person has constipation, we want to know why a person has a constipation. Do we need to refer the patient to GI doctor, gastroenterologist? Do we have to change their daily routine? Do we have to refer them to dietitian so they teach them how to properly eat during that? Maybe the person is lacking fiber in their food. Maybe person needs to add some more exercises because of the motility issues. Sometimes it's just one little detail can help. Recently I read the book. The lady was in her 20s, and the patient, and she was already going for the surgery in her gut, in her intestines. However, she was with a therapist, and the therapist, through many, many sessions, trying to help the patient, just gave her one little thing. She told her, why don't you, when you sit on the toilet seat, elevate your feet, which is your knees, above your toilet seat? As she started doing this, and guess what? Her constipation normalized, and the surgery was not necessary anymore. Sometimes one little thing that we can bring to the patient may change the whole thing for them. That's why I really want to focus on pelvic floor. I really want to help people who suffer from some kind of issue with their pelvic floor. And like this, hopefully, these people will avoid the surgery or any kind of like complications in their life. Is that guaranteed? No. However, we can always try. As we know, every treatment is a trial and error. Every treatment is just, we're trying to find a way, the best way, how we can help that particular person with their background, with their lifestyle, with other things that are incorporated into their life.